Have you ever felt like something wasn't quite right with your health, but you brushed it off? Maybe a little dizziness, unusual fatigue, or a mild pain that seemed harmless. What if I told you that these small signs could be warning signals of life-threatening conditions? The truth is, after the age of 70, our bodies become more vulnerable to sudden health crises. What's even scarier, many of these dangers strike silently without obvious symptoms until it's too late. In today's video, we're uncovering 5 silent killers that can lead to sudden death in the elderly. These aren't just minor health concerns. They are critical risks that can escalate rapidly if left unchecked. The good news is that awareness is the key to prevention. By understanding these risks and taking proactive measures, you can protect yourself and your loved ones from unnecessary tragedies. Stay with me until the end, because what you learn today could literally save a life, maybe even your own. And if you find this video valuable, don't forget to like, subscribe, and hit the notification bell so you never miss out on crucial health tips that could extend your golden years. Number 1, silent heart attacks, a threat that goes unnoticed. When we think of heart attacks, we often picture a dramatic scene, someone clutching their chest in agony before collapsing. The Hollywood version of a heart attack is intense, unmistakable, and immediately recognized as a medical emergency. However, the reality is that not all heart attacks come with such clear warnings. Silent heart attacks, or silent myocardial infarctions, SMIs, occur without the typical crushing chest pain. Instead, they present with subtle, often overlooked symptoms, making them just as dangerous, if not more, than traditional heart attacks. What makes silent heart attacks so dangerous? The biggest danger of a silent heart attack is its lack of obvious warning signs. Because the symptoms are mild or ambiguous, many people do not realize they have experienced a heart attack at all. As a result, they may not seek medical attention, missing the crucial early treatment that could prevent further damage to the heart. In some cases, people only discover they've had a heart attack much later, during routine medical tests such as an electrocardiogram, EKG, or imaging scans. Silent heart attacks can cause just as much damage as traditional heart attacks, leading to long-term complications such as heart failure, irregular heartbeats, arrhythmias, and an increased risk of another potentially fatal heart attack in the future. Unfortunately, because they often go untreated, silent heart attacks contribute significantly to heart-related deaths worldwide. Since silent heart attacks do not involve the classic symptoms of chest pain or pressure, they can be difficult to detect. However, they often manifest in more subtle ways, such as unexplained fatigue, feeling excessively tired without a clear reason, shortness of breath, difficulty breathing, even during mild activities, nausea or lightheadedness, feeling dizzy or experiencing digestive discomfort that does not seem to be related to food, discomfort in the jaw, neck, back, or upper abdomen, unusual sensations or mild pain in these areas, profuse sweating, breaking out into a cold sweat without exertion. Many of these symptoms are often attributed to stress, aging, or other minor ailments, causing people to ignore them. However, if you experience a combination of these signs, especially if you have risk factors for heart disease, it's important to take them seriously. Several factors increase the likelihood of experiencing a silent heart attack, including diabetes. High blood sugar levels can damage nerves, reducing the ability to feel pain and making heart attacks go unnoticed. High blood pressure, hypertension, strains the heart over time, increasing the risk of silent heart attacks. High cholesterol can lead to plaque buildup in the arteries, restricting blood flow to the heart. Smoking damages blood vessels and increases the risk of heart disease. Family history. Having a close relative with heart disease raises your risk. A sedentary lifestyle, lack of physical activity weakens the heart and contributes to obesity and other risk factors. The key to preventing a silent heart attack or catching one early is proactive heart health management. Here's what you can do. Pay attention to unusual symptoms. If you experience unexplained fatigue, shortness of breath, nausea, or discomfort in the jaw, neck, or stomach, do not ignore it. These could be warning signs of a heart problem. Get regular heart screenings. Routine EKGs, echocardiograms, and stress tests can help detect past silent heart attacks and identify any existing heart issues. This is especially important if you have high blood pressure, diabetes, or a family history of heart disease. Maintain a heart-healthy lifestyle. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins, exercising regularly, avoiding smoking, and managing stress can significantly lower your risk. Control underlying conditions. If you have high blood pressure, diabetes, or high cholesterol, work with your doctor to keep them under control through medications, lifestyle changes, and regular checkups. Seek medical advice immediately if something feels off. If you ever feel an unexplained sense of discomfort, extreme fatigue, dizziness, or shortness of breath, do not hesitate to seek medical attention. It's always better to be cautious when it comes to your heart health. Silent heart attacks may not always announce themselves with dramatic chest pain, but their consequences can be just as severe. The key to protecting yourself is awareness, understanding the subtle signs, knowing your risk factors, and taking proactive steps to maintain heart health. By staying informed and vigilant, you can reduce your risk and ensure that your heart stays strong for years to come. Number 2, postural hypotension and falls, the silent spiral into decline. Have you ever stood up too quickly and felt a sudden wave of dizziness? For younger individuals, this momentary lightheadedness may be nothing more than a passing inconvenience. However, for older adults, this sensation could signal something far more serious: postural hypotension, a condition that significantly increases the risk of falls, injuries, and long-term health decline. Postural hypotension, also known as orthostatic hypotension, is a sudden drop in blood pressure that occurs when an individual moves from a sitting or lying position to standing. This happens because gravity causes blood to pool in the lower extremities, reducing the amount of blood returning to the heart and brain. Normally, the body quickly adjusts by constricting blood vessels and increasing heart rate to maintain stable circulation. However, in older adults, these compensatory mechanisms often become less efficient due to aging, medication side effects, or underlying health conditions. Symptoms of postural hypotension include dizziness or lightheadedness when standing up, blurred vision, weakness or fatigue, fainting, syncope, confusion, especially in older adults. While these symptoms may seem mild, they can have devastating consequences. A simple moment of dizziness can lead to a fall, and for seniors, falls are among the leading causes of serious injuries, disability, and even death. When an older adult falls due to postural hypotension, the consequences often go beyond just a bruise or minor injury. Many seniors suffer from fractures, particularly hip fractures, which can lead to prolonged hospitalization, surgery, and loss of independence. The recovery process is often long and difficult, and in many cases, it can lead to a decline in overall mobility, confidence, and mental health. Additionally, after experiencing a fall, seniors may develop a fear of falling, leading them to limit their physical activity. This inactivity results in muscle weakness, joint stiffness, and decreased balance, further increasing the likelihood of future falls, a dangerous spiral of decline that can drastically reduce quality of life. While postural hypotension and falls can be alarming, there are proactive steps that older adults and caregivers can take to minimize risks and maintain independence. 1. Stand up slowly. When moving from a seated or lying position, take a few seconds to transition. Sit on the edge of the bed for a moment before standing. 2. Stay hydrated. Dehydration can exacerbate postural hypotension. Drink plenty of water throughout the day. Avoid excessive caffeine or alcohol, which can contribute to dehydration and worsen symptoms. 3. Check medications. Many medications, especially those for blood pressure, heart disease, or depression, can contribute to dizziness. Work with a doctor to review prescriptions and adjust dosages if needed. 4. Use supportive equipment. Install grab bars in the bathroom and near the bed. Use handrails when climbing stairs. Consider a walker or cane if balance is a concern. 5. Regular exercise. Strengthening leg muscles and improving balance through exercises like Tai Chi or gentle yoga can help maintain stability. 6. Monitor blood pressure. Check blood pressure regularly, especially before standing up. If dizziness is frequent, consult a doctor about treatment options. By taking these preventative measures, seniors can maintain their independence, reduce fall risks, and avoid the downward spiral of injury and decline. A proactive approach to postural hypotension can mean the difference between a healthy, active lifestyle and a life restricted by fear and frailty. Number 3, deep vein thrombosis, DVT, the hidden blood clot danger. Deep vein thrombosis, DVT, is a serious medical condition that occurs when a blood clot forms in one of the deep veins of the body, most commonly in the legs. While the clot itself may not cause immediate symptoms, the real danger arises if it breaks loose and travels through the bloodstream to the lungs, causing a pulmonary embolism, PE. This can be a life-threatening emergency, blocking oxygen from reaching vital organs. DVT typically develops due to slow or restricted blood flow, which can happen for various reasons. One of the biggest risk factors is prolonged immobility, such as sitting for extended periods on long flights, car rides, or even while bedridden after surgery or illness. When blood moves too slowly, it can begin to pool and form a clot, increasing the risk of DVT. Other risk factors for DVT include medical conditions and surgeries. Certain medical conditions, such as cancer, heart disease, or clotting disorders, increase the risk of DVT. Major surgeries, especially hip or knee replacements, can also heighten the likelihood of clot formation. Hormonal factors. The use of birth control pills, hormone replacement therapy, or pregnancy can make blood more prone to clotting. Obesity and smoking. Excess weight puts added pressure on veins, while smoking damages blood vessels, increasing clot risks. Genetics and age. A family history of DVT or being over the age of 60 further elevates the risk. DVT can sometimes develop silently, but there are key symptoms to watch out for, including swelling in one leg. Typically, DVT affects only one leg at a time. Pain or tenderness in the affected leg, especially when standing or walking. A feeling of warmth in the affected area. Skin discoloration, often turning red or bluish in tone. However, if the clot dislodges and travels to the lungs, it can cause a pulmonary embolism, which presents with sudden shortness of breath, chest pain that worsens with deep breathing, a rapid heart rate, coughing up blood. If you experience these symptoms, seek emergency medical attention immediately. Fortunately, there are effective ways to reduce your risk of DVT. Move frequently. Avoid sitting for long periods without moving. On long trips, make it a habit to stand up, stretch, and walk around every 1 to 2 hours. If bedridden, try foot and leg exercises. Stay hydrated. Drinking plenty of water helps keep blood circulation steady and prevents thickening of the blood. Wear compression stockings. These special socks help improve blood flow and reduce swelling in the legs. Maintain a healthy lifestyle. Regular exercise, maintaining a healthy weight, and quitting smoking all help lower DVT risk. Be cautious with medications. If taking birth control or hormone therapy, discuss your risks with a doctor. Know your risk factors. If you have a history of blood clots or a family history of DVT, talk to your doctor about preventive measures, including blood thinning medications if necessary. By staying aware and proactive, you can significantly reduce the risk of DVT and protect your overall vascular health. Number 4, undetected infections leading to sepsis. Sepsis is a silent killer, often developing from infections that seem minor or routine. Many people assume that a small cut, a urinary tract infection, UTI, or a mild respiratory infection is harmless and will resolve on its own. However, if an infection goes undetected or untreated, it can trigger a severe immune response, leading to sepsis, a life-threatening condition that can cause widespread inflammation, organ failure, and even death. How do infections lead to sepsis? Infections occur when bacteria, viruses, fungi, or parasites invade the body and multiply. Normally, the immune system fights off these invaders effectively. However, if the infection spreads or the immune system overreacts, it can cause a cascade of inflammatory responses. This overwhelming reaction can lead to a dangerous drop in blood pressure, reduced oxygen supply to tissues, and ultimately multi-organ failure. Some common infections that can lead to sepsis if left undetected or untreated include urinary tract infections, UTIs. If bacteria travel from the bladder to the kidneys and bloodstream, it can trigger a serious condition called urosepsis. Pneumonia and respiratory infections, lung infections, especially in older adults or individuals with weakened immune systems, can quickly escalate. Skin infections and wounds, even a small cut, scrape, or surgical wound can become infected and spread if not properly cleaned and monitored. Gastrointestinal infections. Conditions like appendicitis or diverticulitis can lead to sepsis if the infection spreads into the bloodstream. While anyone can develop sepsis, certain groups are at a higher risk, including Older adults and infants, their immune systems may not respond as effectively to infections. People with chronic illnesses, conditions like diabetes, kidney disease, cancer, or autoimmune disorders increase the risk of infections leading to sepsis. Individuals with weakened immune systems, patients undergoing chemotherapy, those taking immunosuppressive medications, or people with HIV/AIDS are more vulnerable. Hospitalized patients, surgery, catheter use, or prolonged hospital stays can increase exposure to infections. Sepsis can progress rapidly, so early detection is critical. Warning signs include high fever or low body temperature, chills and sweating, rapid heartbeat and breathing, severe weakness or extreme fatigue, confusion or difficulty concentrating, low blood pressure leading to dizziness or fainting, reduced urine output, which may indicate kidney dysfunction. If you or a loved one experiences these symptoms, seek medical attention immediately. Delaying treatment can lead to septic shock, a critical state with a high risk of death. What you can do to prevent sepsis: never ignore infections, no matter how small. Clean wounds properly and seek medical care for any infection that doesn't improve. Watch for early warning signs. If you experience fever, chills, confusion, or unusual fatigue, don't dismiss these symptoms. Get prompt medical care. If an infection worsens, doesn't respond to treatment, or spreads, consult a healthcare provider immediately. Stay up to date with vaccinations. Vaccines against flu, pneumonia, and other infections can reduce the risk of developing sepsis. Practice good hygiene. Wash hands regularly, keep wounds clean, and follow doctor's instructions when taking antibiotics to prevent drug-resistant infections. Sepsis is preventable with awareness and early intervention. By recognizing the risks and acting quickly, you can protect yourself and your loved ones from this dangerous condition. Number 5, medication mismanagement, a hidden time bomb. As we age, the number of medications we take often increases. Whether managing chronic conditions such as high blood pressure, diabetes, arthritis, or heart disease, seniors frequently rely on multiple prescriptions to maintain their health. However, this growing list of medications can quickly become a hidden time bomb when not managed properly. Mixing the wrong drugs, missing doses, or taking too much of a certain medication can lead to dangerous health complications, including sudden cardiac events, strokes, or internal bleeding. Many older adults fall into the trap of medication mismanagement due to factors such as memory issues, complex prescription schedules, or even a lack of clear communication with healthcare providers. Some of the most common medication-related risks include drug interactions. Certain medications, when taken together, can react negatively, leading to increased side effects or dangerous health conditions. For example, blood thinners like warfarin can interact poorly with common painkillers, causing excessive bleeding. Missed or incorrect doses. Forgetting to take a medication or accidentally taking too much can disrupt treatment plans. For instance, missing a dose of medication for high blood pressure could result in a sudden spike in blood pressure, increasing the risk of a heart attack or stroke. Side effects and allergic reactions. Some medications can cause drowsiness, dizziness, or confusion, increasing the risk of falls and injuries. Others might trigger severe allergic reactions, leading to breathing difficulties or anaphylactic shock. Over-the-counter and supplement risks. Many seniors take over-the-counter pain relievers, sleep aids, or herbal supplements without realizing they can interfere with prescription medications. Even something as common as aspirin can be harmful when mixed with certain prescription drugs. Managing medications effectively requires a proactive approach to ensure safety and prevent life-threatening mistakes. Here are some essential steps to take. Keep an updated medication list. Always maintain a current list of all prescribed medications, over-the-counter drugs, and supplements you take. Include dosages and times of administration. Bring this list to every doctor's appointment to review potential interactions and make necessary adjustments. Use a pill organizer. A simple pill organizer with labeled compartments for each day of the week can help prevent missed or duplicate doses. For those with more complex medication schedules, electronic pill dispensers with alarms can provide reminders. Set medication reminders. Using alarms on your phone or dedicated reminder apps can ensure you take medications on time. If technology isn't an option, writing reminders on a calendar or placing sticky notes in visible areas can also be effective. Consult your pharmacist and doctor Regularly. Pharmacists can provide valuable insights into potential drug interactions and offer safer alternatives. Schedule medication reviews with your doctor at least once a year to reassess dosages and effectiveness. Be cautious with over the counter drugs and supplements. Always check with your healthcare provider before adding any new medication, even if it's just a vitamin or herbal supplement. Some supplements, such as St. John's wort, can interfere with antidepressants and other critical medications. Medication mismanagement is an easily overlooked yet serious risk that can have devastating consequences. By staying informed, organized, and proactive, seniors and their caregivers can take steps to ensure medication safety. With the right precautions, the hidden time bomb of medication errors can be diffused, leading to a healthier and more secure life in the golden years. Now that we've explored these 5 sudden death triggers, it's time to reflect on your own health and that of your loved ones. Are you unknowingly at risk? The good news is that awareness is the first step toward prevention. Understanding these risks empowers you to make informed choices that can significantly improve your well-being and longevity. Prevention doesn't require drastic changes. It's often the small, consistent habits that make the biggest difference. Stay hydrated to keep your body functioning optimally. Move regularly to promote circulation and heart health. Manage stress through mindfulness, deep breathing, or meditation to reduce strain on your cardiovascular system. If you take medications, double-check them with your doctor to avoid harmful interactions. Prioritizing sleep, maintaining a balanced diet, and scheduling regular health checkups can also go a long way in preventing unexpected health crises. Your health is in your hands, and every proactive step you take today is an investment in a longer, healthier life. If you found this video valuable, please like, share, and subscribe to Buddhist Mindfulness for more insightful content on well-being and longevity. Stay safe, stay informed, and I'll see you in the next video.